Great. Good morning, everybody. I'm Christine Hancock, very pleased to welcome you to one of our international seminars. These seminars, which at C3 we've been holding regularly since our very beginning, over 10 years ago, are really designed for people to learn from other countries. Of course, until very recently, they were breakfast seminars and we held them in our offices and people mingled with each other and enjoyed a healthy breakfast. But for the last 2 years, they've, not surprisingly, been online. And that has other great advantages, opens us to a wider audience, and it means our international visitors don't have to get on planes. Although in this case, we're delighted to be listening to people who are in Lille, in northern France, and probably less far away from me and C3 in London than many of our UK audience are. So C3 is about preventing chronic disease, and in particular, helping people to live healthier lives. And we really focus a lot on those risk factors that drive poor health and premature death, smoking, lack of physical activity, and to a large extent, what we eat and drink. And the issue of obesity being much talked about in this country and globally, but more talked about than real focus and action. And that's why we're especially delighted to welcome this morning Stephane Sibalo from Vivons en Forme, because VIF, as we call them for short, have done some fantastically successful work around towns in France, particularly concentrating on families. And for the last almost 3 years now, 2.5 years, C3 has been delighted to work with VIF and several other partners in a large EU project called Aspire, which brings together the two issues of obesity and unemployment. And the project is working in areas of England and France together. And I always thought I knew France very well, that this detailed working together has given us a lot of ideas and lessons from how things are working in France. In the UK, I think we always think that obesity isn't a problem in France. Well, it's not as bad a problem as it is in the UK, but it is significant. Something like 1 in 6 people in France living with obesity. And as in England, people from the most disadvantaged areas have much higher levels of obesity. So I'm not going to talk more. I'm going to hand over to Sophie McGannan from the Health and Europe Centre, who are the overall managers, leaders of this large project, and to Stephane Sibalo, with whom we've been really pleased to work on this project and more widely. They will speak this morning and then open up for questions and comments. We are recording, so the record will be on our website at the end, and hopefully you're all on mute for the moment. So Sophie, Stephane, you're very welcome. Thank you for joining us, and over to you now.
Thank you, Christine.
Thank you, Christine.
So I'm going to get started and then I'll hand over to Stephane. I will just share my screen if that's okay. Okay. So my name's Sophie McGannan. I'm from the Health and Europe Centre, as Christine mentioned, and we are a social enterprise that brings partners across Europe together and obtains funding for European projects, this being one of them. So I'm going to give you an overview of the Aspire project and then hand over to Stephane to talk more about what Aspire and what VIF are particularly doing in France. And we're coming to you from Lille, and more specifically an area of Lille, a town just outside of Lille called Saint-André-des-Lilles, where Aspire is happening with a hub site here. So we'll be talking more about that. So a little bit about Aspire. Aspire stands for adding to social capital and individual potential in disadvantaged regions. And it's funded by the Interreg FCE program. So that's the France Channel England program. There we go, just get rid of that. And we've got more than 7 million euros of funding from that program, which brings together partners from the UK and France. And the project has over 10 million euros when you bring in all the partner contributions, and that's 15 partners. So we've got a real range of people working on this project. And you can see on the screen the Interreg logo that we use, but also our Aspire logo, which says health, well-being and opportunities. And that's really what this project is all about. The project has also funded the building you can see on the screen. I would have liked to have more pictures, but I haven't been able to get hold of any more pictures recently. I haven't been able to get down to Boscombe, but the building has just launched recently. It was installed in April 2021, and all the work is finished this year, so it's just launched, and that's being used as a community centre to roll out Aspire, like we're doing here in Saint-André-les-Îles. So the challenge for Aspire was tackling, and as Christine just mentioned, we tend to have this idea that obesity is not really a problem in France, but it is. So high levels of obesity coinciding with high rates of unemployment and socioeconomic disadvantage. So obesity in France is particularly a problem here in the north of France, where there is a lot of socioeconomic disadvantage. And the goal of Aspire was to reduce obesity, improve well-being and increase employability. So that's where that health, well-being and opportunities logo came from. So just touched on it there, but the aim of Aspire was to combine health, well-being and upskilling opportunities in one program. So that's kind of the innovation side of Aspire, that was really combining those things together. What we tend to see at the moment are health and particularly weight loss programs, and then we have job centres in both countries that are putting things in place to upskill people, CVs, all of that kind of stuff, but nothing was bringing those elements together. And in these areas where there are high rates of obesity and high rates of unemployment, our question was why and what can we do about that? So we kind of had this ethos at the beginning of the project for grow your own, eat your own, sell your own, and bringing together those different elements. So the outputs of the project, and I'm aware I'm very much talking in project management speak, but I'm the project manager, so that's what I do, is to reach participants via 7 hub sites. And actually the hub site that Stephane and I are sitting in now is the 8th. So we brought on a new hub site in France, based on the learning from the 7 that were already kind of rolling out Aspire. And we're also bringing in another one in France. What are we today? The 30th of June. So tomorrow, another one starting up, and hopefully we'll see more rolling out in the UK as well. So the participants come to these hub sites, and that's where they have access to all the activities that we're rolling out, one-to-one support, which is extremely important in this project, and also really a focus on self-esteem. And oh, the lights have gone out. Hopefully you can still see me. They're on an automatic timer. And via those 7 hub sites, we're aiming to reach 20,000 people. So not 20,000 people receiving one-to-one support, as you can imagine, because we simply don't have the manpower to do that. A smaller number of people on one-to-one support, but when you reach out to their family, their wider community, their network, actually we're going well beyond 20,000 people, and informing and destigmatizing obesity and unemployment within those wider networks and those communities is really key to making those changes long term. So I'll let Stephane talk more about the VIF program. And obviously, if there are any questions at the end, I'll still be here to talk about Aspire and the project management side. So I'll hand over to Stephane for the next bit.
Okay, so I'm Stephane Sibalo, and I'm working for VIF as a project director, and mainly for Aspire development. Just a few introduction about VIF. So VIF is a health program, and we operate in France since 30 years now. Maybe some people inside the group, maybe they know VIF program as EPOD, because we start in 1991 through EPOD program. It was an European program to prevent obesity. And since 2020, we have changed our image, and we have a new logo. And the idea of VIF is to really focus on people behavior and how we can make people experience a good lifestyle. The idea is that if you are trained to have a good lifestyle, definitely you will make the best choice for your life and your health. What is it really interesting for VIF is that we have 2 scientific studies who attest the effectiveness of VIF on overweight and obesity for children. And now we are working on new protocol to create new studies in order to show the effectiveness of the program. As Christine introduced VIF, we are located in the cities. Actually, in France, we are located in 264 cities. I would like to say 2,000, but it takes time. And because what is really interesting for VIF is that we always, our aim is to help people to have a better health condition, but we never ask them to do something. We just invite them to test a new experience, and after they test it, they will enjoy it and discover that this experience is better for their lifestyle. We are working with the city mayor and also with 2 people inside the city who are dedicated to help inhabitants who help all inhabitants to take care about their health. One project leader, and another one is the person who is elected and who represent the city mayor. All topics we develop are based on social marketing and nudge, and idea is to deliver a program who will be run by trainers on the field. That means people who are in contact with the final population. Finally, VIF is a B2B to C program. And our main target are children and parents and adults actually, but children and parents at the beginning, adults, and at the end of the year we will move to seniors. The idea is not to every time. The idea is everybody know that you should eat 5 vegetables and fruits by day. You should walk 10,000 steps by day. But who have the time to do it? how you can do it and how you can install the routine inside your life. And the idea is of Viv is to help from when you are young until you are a teenager, and after you are adult, to first to learn the good way to do it, and after how to maintain and to keep it in your personal life. This is a map of where we are located actually. So because we are from the north, NGO from the north of France, so where we have a big network in the north of France. And since 2 years, we are working on French sovereign territories. And the first one is Réunion Island, near to Madagascar, and Mauritius Island. And we are continuously develop. Thanks to the COVID situation, now the Ministry of Health, they want to promote prevention, and instead of focusing on le soin,
care.
Instead of focusing on care, because care is costly for sure, and more costly than prevention. Now we will focus on Aspire, and mainly what we do in Aspire as a hub. In the beginning of Aspire program, we are working on the model of Aspire program, and also on some topics to deliver some training for the trainers. And since 1 year, we decide to move to become a hub. That means for us to work closely with a city. We are based in Saint-André-des-Lilles, and this city is already a VIF partner. And why we decide to work through the city is that what is really important is that all cities have health competencies, because the Ministry of Health
the ministry, yeah, the how do you say that in English? The Ministry of Health has a kind of, the city has obligations within the framework, as it says on the slide, within the framework of the Ministry of Health. So helping them reach those obligations is really the role of the.
And inside the city, in France, you have two kinds of social center. The first one is the CCAS, and the second one is CSC. Is that where these centers are dedicated to target population in need of assistance. For example, you can CCAS. They have the competencies to help parents to accompany children to go to school, or after school, or if you need if you are senior, you can go to CCAS to discover all kind of activities you can have in the city. And what is it really interesting in the French organization is that the CCAS is also the arm of the city to help people who are away from work, who are in vulnerable population, to help them to find a new way, and also to find a job. Sorry, and the idea is that we contact this organization, and they help us to recruit Aspire attendees. We have developed in the hub 4 kind of workshop. As Sophie explained in the beginning, the goal of Aspire is to help to raise people on competencies on food, on self-esteem, and also to help them to be more confident to reach a job, to decide to move to have a job. This is really important on this kind of target. They are away from work, they are sometimes isolated, and most of the time they are suffering from obesity or from overweight. And other things really important is that they have a low income. And the idea is through some food workshop, for example, the idea is we use the food from the food banks without telling them that the food comes from the food bank. We help them to, and we teach them to cook the food. We teach them how to increase, how to
how to manage the cost of buying foods, and yeah, how to shop on a budget, food shop on a budget.
On physical activity, during the physical activities, is just to show them that they don't need to do sport. The first thing they should do is just to be active, to move, and to move every day. Instead of using their car, if they have one, they can do things by walk, by bus, by public transportation. And public transportation, where when you have low income in France, they are very cheap. So you can use public transportation instead of using your own personal car. And also to show them that thanks to physical activities, you can enjoy some motivation, and you can have some pleasure to do it. During the sophology workshop, we are talking with them, and we are convincing them that they have all the solution inside. They have all the competencies, and they can be proud of what they are. And in order for them to be proud of themselves, and don't be afraid about their physical appearance. This is really important for them. And the last topic we are working on is about the psychology workshop. And during this psychology workshop, the idea is to how they can express themselves without any taboos, and also how they can engage a conversation with people they don't know, and without sorry for my English. It's really difficult for me to express what we say in French and in English. And so,
c'est vraiment leur donner les clés pour qu'ils puissent devenir, qu'ils ont autant de compétences que les autres.
Yeah, give people tools to feel like they have just as much worth and purpose as someone who's had jobs, higher education, training. And then I think one of the key things that we've tried to do is show people that if you've never had a job and you've never had any higher education or any kind of training, you still have a CV, and you can still draw upon all of your life experiences and transfer those skills into work, into volunteering, whatever it might be.
I have also put on this document the cost of each workshop. Actually, we hire some professional, and the cost of each workshop is around 360 € for a group of 10 to 12 participants. The idea is that we need these people to have time to express themselves and also to be confident on themselves. We are working through these 4 topics with them during 12 weeks. This is some information we give to them after the workshop. For example, you have two kind of booklets. Leaflets. So 2 kind of leaflets and recipe booklet. And what is it really interesting in this booklet is that we worked with the food bank of in France, and we asked them which kind of food people can buy for for a few money, or we can receive for free. And we create some recipe, some really simple recipe, and people can do it at home very easily. We never mention to all participants, to all attendees, that this booklet is made with food come from food bank. And during the workshop, we hire a dietitian. And the idea is to share the moment they cook together. At the beginning of the workshop, they don't know each other. At the end of the 12 weeks, they have created something new. A new relationship is established. Some of the people inside the group, at the beginning, they never see nobody during a week. Maybe 1 or 2 family members, and no one from outside their first circle. At the end of these 12 weeks, some of them have increased their friend. Their circle of friends. Thank you, Sophie, for. Just another contents on what we are sharing in during the sophology workshop about the resilience and how they can increase their resilience when life gets hard. I think it's really it's not something specific, and just to give them some inputs. And what also is really good for them in France is that all these, except for this project, but normally during the normal life in the social center, all activities are free, or maybe they will pay maybe 2 € or 5 € according to their annual revenue, and so it's really accessible, because if you go by yourself to meet a sophologist, it's really expensive. I'm sorry. for physical activity workshop. So every time, each topic we develop, we have one topic for the participant, for the and it's just a leaflet who contains some exercise, who is a resume of all activities, and we have developed on the same time a training for trainer in order to give some input during the workshop. Another thing we have developed is the dice game. So they launch the dice, and during the workshop they have to do something. For example, instead of using the bicycle, they have to walk during 30 minutes, or they can do the pink flamingo, or they can climb the stairs instead of using an automatic escalator. Thank you. In addition, we have created a digital platform. The purpose of this digital platform is to help the attendees to continue to experiment the Aspire experience at home. So we have developed 4 weeks of topics, and following the same topics we have seen before, about how to cook, how to shop, how to move daily, how to have a good sleep, and how to take care about yourself, and how to keep in a good health and a good body shape. And to conclude what we have created, we work with the French partner and now with the UK partners about on a practical guide.
So I'll take over. So yeah, that this actually wasn't initially intended to be part of the project, but the working with participants and working on the model of the project found that, as it says on the screen, 33% of unemployed people who are obese have actually said they've been asked questions about their weight during their job search. So whether that's by an employer or in the job centre, or even friends or family who doubted them, that's a shocking statistic. And I think even more shocking is the next one, that 45% of these people actually think that it's acceptable to be denied a job because of their size, their weight. And for us, that was part of the long-term sustainability of what we're trying to do in Aspire, is actually changing kind of the landscape and making sure that, okay, people are coming to our program because they want to, for the most part, want to lose weight, want to live a healthier lifestyle, but actually that doesn't mean they shouldn't already be able to seek employment and go into the workplace. So although the two things might seem in a sense kind of contradictory, they're really important together, because we can't say to people, right, you've got to come to our program for 12 weeks, lose weight, and then you'll get a job. No, the idea is they should already be out there and be accepted in the workplace and on the job market. So the practical guides are really for employers to fight against that discrimination, and more importantly, promote inclusion, break down some of those barriers, destigmatize the whole subject, and say, actually, it's a positive thing for employers to be including everyone in their workplace and having a more diverse workforce. So on the next slide, you can see there are 6 practical guides within that document, which really take the employer through those steps. And the idea is not to say to the employer, you're doing something wrong, you're discriminating. It's to say there is a discrimination issue in general, and what can you do to be fighting against that and to be inclusive. And I think the way that came about as an additional output of the project is really linked to what's so important in France, and Stephane mentioned them, are the social centres that are in the community that already work with people, and that's been a real advantage for Aspire in France, is that there's already this community-based organisation that has these conversations with people, which is where this guide came about, because people are already working so closely with people in the community that they have those conversations, and creating that trust is so important already, which has really helped us. Whereas in the UK, we've had to really work to establish ourselves in communities, and you saw the building in the first couple of slides. We've had to create a community hub, we've had to create a centre, because that just didn't exist. And in France, that already existed, so it was easier to go into the communities and put in place that empathy-based approach, working with people to build their self-esteem, and showing them that we're actually going into workplaces and fighting their cause really helps to encourage them to join the programme, to trust us, to trust the people they're working with, to build their confidence, build their self-esteem. I don't know if you had anything else to add about the practical guide.
I had a chance to have an interview during 2 hours on the public radio, and what was I was really astonished when we talk about the practical guide, and also about the experience of Aspire. Normally, when you talk to other topic, many people just call on the radio and want to share something. And during I spent 2 hours on the radio, and nobody called. But we receive a lot of email and a lot of message from the social media, and every time people who are suffering from discrimination, the situation is really difficult for them to share the experience, just to share what they have suffered, and sometimes they don't realize that it's not normal to be treated like that. It's not normal to be treated like that. For them, it's the normal life to suffer from discrimination, to be stigmatized, or to hear or to be judged by people when they go for shopping, when they go outside just for work, and people just look at them, and maybe people don't say nothing, but just the way they look at them definitely is thanks to this project. I realized that it's even for me, when I look to somebody now, I pay attention how I look to these people, because you can hurt people without be conscious that you do it. And thanks to this guide, because during to create this guide, we have made many interviews, and I've discovered that sometimes I can stigmatize somebody without paying attention. So it's really it's inside our conscious, is the way we have been educated, is the way we have be training during the school, during our school, and it's just we must change, and also we must take care of everybody.
Thank you.
Thank you.
I don't know. I think there might be already something in the chat. Oh, so this will be shared. Your future seminar.
That's great, and we can. I'm sure there will be loads of questions. I have a few things that I think I'd quite like to draw out from that really interesting presentation. And I've been working with them both, so I know quite a lot of it, and still found new things, interesting things. But as I said in my introduction, I think that one of the really interesting things are some of the differences and what they say about the two countries and what they say about how we should be focusing. So I think the emphasis on local centres and the emphasis generally on local level in France and in the UK, that's in general a subject of quite a lot of political debate at the moment. C3's initial role in this project was to do our community engagement program in each of the areas, what we call CHESS, and my colleague Natalie, who's on the call, did the work in the 4 French sites, and Elizabeth, who's also on the call, and Antonia did the work in the English sites. But that local level, that those centres, those hubs locally, are a definite difference between the two countries. I think the fact that obesity is a disease in France and is not in this country what we call one of the protected characteristics, although there is discussion going on. So there may be some interesting things that we can learn from the French position where it is recognized as a disease. And then I'm sure most people picked up this word sophrology, which I've been struggling with because it doesn't exist in this country, though I think a lot of the content, so workshops around mental resilience, which was Stephane's example, certainly do exist, are understood in this country. So last time I was talking to Stephane, I Googled sophrology in the UK, and it exists, and they're all French, or practically all French. So when you come to translate words, as we found in some of the work we're doing with Beef, it's more than a dictionary translation. It's a cultural adaptation as much as a translation. So I think there are comments and chats arising, mainly saying what a great presentation.
I'm happy to talk about my experience, Christine.
Please do, Natalie. Yes, please.
Yeah, so thank you very much for your presentation, Sophie and Stephane. So as Christine said, I worked on the Aspire project, and I'm the project manager on the French part of the project. And I wanted to say that I was lucky enough to go to the site Stephane talked about in Saint-André, so I could assist and see a workshop. So it was people, I think they were at that 4th or 5 weeks in the program, and I could see that the way they connect between each other, that's very important in the program, because I realized working in France that a big part of this project was that we were able to make people connect between each other, and then to talk about and share their experience on the way, and to learn, obviously, new skills. And I wanted to ask you a question, maybe to explain more about soft skills and how it's very important in this project, that the way you combine the unemployment issues with obesity issues, and to bring these soft skills as something that will help them to gain some more self-confidence?
Yeah, thanks, Natalie. I'll answer that one. I touched on it very, very lightly earlier about helping someone build a CV. So that's one example of soft skills. And I give a more concrete example. In one of the hub sites in France, there was a lady who came along. She was a mother of 3. She'd never worked before, and she finished school when she was 16. She was also living with obesity, and her kind of thing when we got down to the one-on-one conversation was, well, I can't get a job because I don't have a CV. I don't have any skills, is actually what she said. And one of our hub sites, one of the hub site managers said to her, hold on a minute, you're a mother of 3. Surely that takes some level of organization, some kind of skill. And then talking about it, she said, well, yeah, I take the youngest to school and then I come back and I make lunch and I do this and that. And it turned out she was actually incredibly skilled and had plenty of transferable skills and what we call soft skills, which are things like emotional intelligence, her ability to organize a household, to keep on top of things. And I think that's something, soft skills in general are really overlooked and underrated. And that's really something that the participants coming to Aspire, it's the key, is telling them, or not telling them, but for helping them find their soft skills. And it's almost a shame that we call them soft skills, because they're not soft, they're skills like the rest of the skills, but they're skills that we can't put a price on. We can't say, well, you went to university for however many years, or you went to a training course, or you
don't have any diploma for
yeah,
soft skills.
Exactly. That's the problem, but also helps once you're guiding people to looking for those skills, that everyone can find them. And it's just about then how do we help our participants to formulate that, whether it be a CV, a letter to an employer asking for a work experience day, something like that. What can they bring to that organization?
Absolutely. One of the things working in our chess program, where we use an app to scan the environment, with some people we were working with in East London, some young women who were struggling, and some of them new immigrants. And one of them said, can I have a certificate to say I've used that? And initially we just gave a sort of short message, and then we realized actually that's quite valuable, that just that they've participated in this event has given them some confidence and they want to show off about it. So Antonia's got a couple of questions, and then Christy Sanderson next. If you unmute your, thanks Antonia, over to you.
Thanks. Actually, I just asked one of them, I guess, because I know there's other people who've got questions too, but could you tell us a bit more about whether VIF has been evaluated and what you've learned or what you've changed as a result of what any evaluations have taught us?
Thank you very much for your question. About evaluation, during this project, we work closely with University of Bournemouth, and we are going to publish, I think at the end of the project, for the final conference, we are going to publish the full evaluation about how Aspire works and about the result for the Aspire attendees. For VIF, what we are doing is we evaluate constantly every workshop. We evaluate, first of all, we evaluate the satisfaction. Did the participant are satisfied by the workshop? Did they learn something? And also we evaluate all documentation we give them. We give to them. The idea is to continuously improve our documentation, and that documentation should be very helpful. For sure, as I said at the beginning, everybody know now that you should eat free vegetable and free foods by day, but how you can do it, and is the way we work is that we produce some document that can be used by anybody.
I think the evaluation actually goes hand in hand with your first question as well, about how do you recruit people, because the recruitment's completely voluntary, and all we do is advertise that we're there, and people come along, and that goes hand in hand with the evaluation, because if people aren't benefiting from the workshops, they won't stay. So we constantly ask people, what do you want? How can we help you? What would make you happy? What would encourage you to come along? And we adapt our workshops based on what people are interested in. And I think that's something that a lot of people in some of the socioeconomically disadvantaged areas we're working with, they've never had that. They've always had people telling them. The job centre in France is called Pôle Emploi, and when you're looking for a job, they send you have to come to this CV workshop, otherwise you're going to lose your benefits. You have to go to this whatever workshop, and it's not something that's necessarily interesting or beneficial to those people. For some people it is, but that's what I think has kept people coming back to our workshops, is the evaluation, but including them in it, really asking them, do you enjoy what we're doing? And if you don't, how can we change it? How can we make it better for you?
And other things really interesting is that at the beginning, we want to buy some computers, some laptop for the social center, in order to help people to design their CV, to help them to how to find a job on the internet and everything. But finally, the participants they don't want this kind of workshop. They are not interested in. What they like is to have a workshop where they can meet people, real people, and discuss with people. And that's the main point of this project. Share your experience.
So Christy Sampson, if you want to come off mute and ask your question, please.
Hi, thanks. I was really interested, excuse me, how the project evolved to look at the employer side of things, because obviously they're a critical partner here. And I really liked the description of your guidance. I just wondered if you could tell us a bit more about the reception to that, what you know about how the employers are kind of engaging with it or using it.
Great, thank you.
Thank you, that's a great question. So the guides actually looked like this in real life. So there's something we were able to go and literally hand out to people, but also make them accessible online. And some of the kind of anecdotal feedback, because again, this is all being properly evaluated by the university, but some of the anecdotal feedback, when I went to a job fair to hand them out, initially it was actually quite, there was quite a lot of resistance initially, because the employers were saying, we don't do this.
Exactly.
And you, Stephane worked with Decathlon, a big sports shop company in France. I think they're also in the UK now. Yeah. And they were like, no, we don't do this. This isn't our problem. This is what other people are doing. And it was by working with them and talking to them and changing the language we were using to inclusion rather than discrimination that we were able to get them on board. And then we had a lot of people who were kind of taking the guide away and getting in touch later on saying, actually, the guide helped us realize, and Stephane touched on it, that it's a lot of it isn't, people are doing it unconsciously. They're not realizing that a place like Decathlon, and I come back to them because they were really a company that had a big turnaround, because they came back and said, actually, you're right, everyone, we're a sports shop, and their brand is accessible sportswear, it's inexpensive, and everyone working here, we hired them because they looked sporty, but actually they're not the people we're trying to sell to. We're trying to sell sportswear to people who don't necessarily run, or they're not really active, really athletic, really sporty. So if we changed our approach and hired normal people who come and have the skills to work here, whatever they look like, it's actually beneficial to us. And it's always, I work on loads of these projects, and whatever the topic, we're always trying to engage with employers, and the angle you always have to take is what's in it for you. They're there to make money, most of them, and they want to know what's in it for them. And I think it was by taking that approach that then the feedback became more and more positive. And people were saying, actually, yeah, we're doing this. We didn't realize we were doing it. And these guides are kind of giving us and it's using social marketing and nudge theory. Again, we're not asking companies to completely overhaul their entire ethos, fire everyone and rehire everyone, but just gently nudging them to take a look at themselves and what they're doing, how they're interviewing people, and what kind of questions they're really asking.
Great. Thank you. And thank you to our audience for great questions. Sophie, Stephane, if there's anything burning that you want to add, but thank you, a big thank you to you both.
No,
No?
okay.
Yeah.
Yeah, thank you.
Thank you.
We in C3 are looking forward to working with you to bring some of those lessons into the UK, along with the other partners of Aspire. So that's been really, really interesting. I'd like to, I think it's on the chat now, but to invite you to our next international seminar. We're having a break over the summer, but on September the 8th, Stella, who's actually here, is going to talk about community health workers, her experience in Ghana, and whether that translates to the UK. And again, something that people are talking about, nobody's quite sure. And hopefully our seminar, and I'm sure, having listened to Stella speaking a little, will be really interesting for people across the UK, but also other places, including France. So thank you all very much indeed for coming. If you're not already on the C3 network, please sign up. We don't deluge people. You can always unsign, but then you'll be aware of many of the things that we're doing and we're interested in. And that very much includes Aspire and our work with Vivons. So thank you both very much indeed for a great seminar. Thanks everybody, and have a good day.
Have a good day. Thank you. Bye-bye.